the PowerPoint, so we were going to just tell Patches like when to switch slides. We can just tell you the same.
Yes, that would be wonderful.
Thanks.
Okay, we are a go. And I will pull up the PowerPoint slide.
Before we start, I want to apologize to the community for the late start. We had some technical difficulties, so thank you for bearing with us. Good evening, I'm Mike Rodriguez. I'm the Associate Secretary of Student Support at the Delaware Department of Education, and have the pleasure of welcoming you to the Delaware COVID-19 Health and Wellness Working Group. This June 2nd, 2020 meeting is being called to order at 5:17. This meeting is being held electronically. On March 12, 2020, Governor Carney issued a declaration of a state of emergency for the state of Delaware due to a public health threat. The state of emergency allows all public meetings of executive branch public bodies, including the Delaware COVID-19 Health and Wellness Reopening Working Group, to be conducted electronically, either by means of telephone conference call or video conference call. The information regarding this meeting, including the information on how to access the meeting electronically, was published on May 26, 2020, on the state public meeting calendar site. Individuals may participate in this meeting via the DOE YouTube channel publicized on the agenda. These meetings are public meetings to provide transparency and the opportunity for the public to engage in the process. In order to enable every participant to have voice, public comment will be accepted via email at reopeningideas@k12.de.us or via voicemail at 302-735-4244. Each week, public comment is compiled from the previous week and posted online. A copy is also provided to the workgroup chairs to then share overall themes related to responses that may impact the work at hand. We encourage working group members to review these comments online before each meeting. To summarize public comment over the past 2 weeks, educators, parents, and community members submitted public comments that voiced concerns and shared ideas about returning to school in the fall. These comments range from ideas for staggered schedules, to student and staff mental health, to social distancing protocols. There were almost an equal number of passionate pleas to reopen school buildings as arguments to keep schools closed and continue remote learning. That is why our work is so important and so difficult. In particular, to our Health and Wellness Committee, we read concerns about students and staff who are immunocompromised to ideas about where to place hand sanitizer. Some, like Vanessa Stansbury, asked questions about whether or not there would be alternative options for families who are uncomfortable sending their children back to school in the fall due to health concerns. These questions are why we built these committees and sought public comment. We have our work cut out for us tonight, so let's get started with brief introductions. Again, my name is Mike Rodriguez. I work for the Delaware Department of Education, and I'd like to introduce my co-chair, Dr. Megan Walls.
Thanks so much, Mike. I'm Dr. Megan Walls. I'm a pediatric psychologist with Nemours. I'm really glad to be here and to co-chair this committee. We're keeping intros brief tonight. I know all of you or most of you heard our larger group intros, but I just wanted to echo Mike's comments that we not only received public comments, but read them, and Mike and I spent some time on the phone going over them. So again, things like medically complex kids, mental health, alternative options are things we are hoping that we can address in each of these meetings, and you'll hear more tonight about how we're planning to do that in each opening scenario. I'm going to let Dr. Mario Ramirez introduce himself as well.
Thank you, Megan. So my name is Mario Ramirez. Megan and Michael asked that I spend just a few extra minutes introducing myself and talking about our organization, Opportunity Labs. I am a practicing emergency medicine physician. I'm actively taking care of coronavirus patients right now, but my training and background has been in pandemic and emerging threats for the better part of the last decade. I served as the HHS Director of Pandemic and Emerging Threats from 2014 to 2015 and worked on the Ebola, MERS, and SARS outbreaks. Our organization, Opportunity Labs, is a nonprofit organization that's currently working in 6 states, and also with 2 large cities and 2 other nonprofit organizations around returning to school. and I am responsible for a lot of the draft text that you may see tonight. But the text is meant to be only a starting point, and very much look forward to having the rest of the folks on this call and the public make sure that we make changes that reflect Delaware's needs and preferences.
Great, thanks. Can we go to the next slide, Alyssa? And you can go one more, I think.
Oh, sorry about that.
So, no worries. So we wanted to make sure everyone on the committee can introduce themselves. We're, again, asking you to keep it brief, just your name, organization, and role tonight. You can go to the next slide. We listed our, there we go. We listed our committee members so that we can not talk all over each other. So if you guys can try to go in the order of who's on the slide, just again, yourself, your title, who you're affiliated with, and we'll try to keep these pretty brief.
Good evening. I'm Kevin Fitzgerald. I'm superintendent of the Cesar Rodney School District. I'm representing the chief school officers on this committee, and I look forward to the conversation and to the results.
Hi, everyone. My name is Laritha Odumasu. I'm the Executive Director of Charter School of Newcastle Middle School, and representing charters as well as schools serving our urban demographic.
Good evening. This is Susan Haberstroh. I'm the Director of School Sports Services at the Department of Education. And within that work group, we have a lot of the school supports from school nutrition, school nursing, school counseling, school climate and discipline. Look forward to these meetings.
Daisy? Dana, do you want to continue?
Hi, I'm Dana Carr. I'm here representing the Department of Health and Social Services and the Division of Public Health, and I work also closely with the Division of Substance Abuse and Mental Health. So I'm just here representing DHSS. Thank you. Looking forward.
Hi, I am Sue Smith, and I'm a school nurse, and I've been a school nurse in the Milford School District for 25 years. And I'm proud to be here to represent the Delaware school nurses. I look forward to working with all of you.
Emma? Daphne, do you want to go on?
Sure. Hi, I'm Daphne Carnwright. I'm a licensed professional counselor and a registered behavior technician. I am the program manager for family support for Autism Delaware and the former chairperson and member of the Governor's Advisory Council for Exceptional Citizens. And I look forward to our work together.
Marcel?
Hello, I'm Dr. Santiago. I'm the director of Lorette Health Center here in Georgetown. I'm also looking very forward to working with all of you.
Good evening. My name is Reverend Pravi Powell Jr., and I serve as a senior pastor of Mount Joy United Methodist Church in Wilmington, Delaware, in the Southbridge community. I'm also a member of the State Board of Education and looking forward to make our contribution and leaning in on the results that this committee has been charged with.
Representative Longhurst? Representative Smith?
Hey, good evening, everyone. My name's Representative Mike Smith. I'm the representative in the 22nd District, Pike Creek Valley, Hockessin area, and I'm on the Education Committee and the Health Committee in the General Assembly. Thank you. Looking forward to working with you.
Hi, everyone. My name is Anthony Del Colo. I'm a state senator representing the 7th Senate District, which encompasses Ellesmere, Newport, bits of Stanton, Marshallton, and that general area. I serve on the Education Committee in the Senate, and I also am happy to be doing work on the Reading Consortium. I look forward to working with everyone on this very important topic.
Senator Sturgeon? Kristen, you want to continue?
Sure. Hi, everyone. I'm Kristen Dwyer. I am the Director of Legislation for the Delaware State Education Association. I'm here representing the almost 13,000 members we have statewide. And they are teachers, paraprofessionals, school counselors, school psychologists, school social workers. List goes on and on and on. I hope to represent them faithfully.
So thank you, committee members, and welcome. So why are we here? Our goal is to work towards a framework that allows Delaware school leaders to decide when and how they open schools safely. But for clarification, our job is not to make sure that they open, but to give them the info they need to decide if that's possible. And if it's not, to make sure that they can plan appropriately for a virtual teaching scenario. Our committee's goal is to look at the scenario-based planning document and to look through each of these three scenarios through a health and wellness lens. Staying focused on the health and wellness lens will ensure we can accomplish our goal in the allotted time. A couple of points to keep in mind. The scenario planning documents will get us about 75 to 80% of the way to our goal. But it's critical that we make this document Delaware specific. This is what we're here to do. It's a Delawareized plan. The planning documents are not set in stone and are meant to be edited to our needs. And I'm sure many of you already have suggestions to offer. Next slide, Alyssa.
So I think the other few things we just want to focus on are that really our goal is to implement actions that are going to keep staff and students and teachers healthy in any scenario. So as you'll see as we go through these meetings, there are different scenarios that we will approach. We also want to really keep a focus on equity and incorporating community feedback. And I think probably more than ever, that's on a lot of our minds the past couple of weeks, how we can make sure education has a lot of equity and moving forward, getting kiddos back. And then the last other piece here is that we want to make sure that we're flexible because as Mike talked about, we do have a good layout. We want to think about Delaware, but we also need to be flexible around scientific data. So as new data about COVID evolves, especially around pediatric infectivity and other school studies, we will certainly take those things into consideration to make sure that we are making the best decisions. Next slide. So here is just an assignment recap. I'm not going to read through all of these dates, but what I want us to take from this is that as part of each weekly assignment, we'll be focusing on one scenario, and we'll discuss what that is today. But we'll discuss those protocols, and as you can tell from this timeline, we have a pretty tight turnaround. So we're asking that the work group members read scenarios ahead of time and come with key points and discussions that they'd like to discuss, with the goal of being able to get those recommendations to the secretary at the end of June.
Next slide. So given our tight timeline and the amount of important discussion we'll need to engage in, it's essential that we set some norms around work group participation. A few norms that will keep us focused are everyone has voice, and one person should not dominate the discussion. We should respect all opinions and honor the multiple perspectives that we have around the table. We should stay focused on our goal / purpose through the lens of the health and wellness. We should be succinct. Please do not speak more than 1 minute at a time. If committee members exceed these time limits, it may require one of the co-chairs to intervene in an effort to give everyone voice and to keep the conversation going. And lastly, compromises may be necessary. As noted in the public comment summary, there are varying opinions. Some people want us to open, others want us to remain closed, others want us to have a staggered start. So compromise will definitely be necessary. During these discussions, we'll provide time prompts to ensure we remain on task. We have about 13 areas that we're going to have to cover, and it should be about 4.5 minutes per area in the effort for us to really achieve the ultimate goal and get through all of them. If you wish to participate in the discussion, please use the raise hand feature, or you may also use the share You may also share in the chat feature. Next slide.
Yep. I think we may have advanced one too many slides forward. There should be one slide before this. Yep. Maybe you got, is there a slide after that slide? One more? Yeah, we'll skip it. I thought that what would be helpful would be if we spend just a few minutes talking a little bit about the pandemic itself and how we think this is going to evolve over the coming year and a half or so. Because what we did at Opportunity Labs was we looked essentially at the U.S. Centers for Disease Control as our sort of true north, and we analyzed the pandemic from the public health and the public safety as the most important consideration that we should be thinking about. And to do that, we felt that it was important to first assess how we think the pandemic is going to evolve in the country over the next 18 to 24 months. And then the follow-on to that, of course, is not just what's happening nationally, but how do we actually contextualize that for what may be happening in our local Delaware communities? And then how should we decide within those communities whether schools should open or close? And so without sort of reading the document to folks here on the committee, there's a bit of pre-reading from pages 3 to 17 that have been circulating. But in short, this coronavirus is behaving differently than other coronaviruses that we've seen around the world. It doesn't behave like our prior SARS outbreak. It doesn't behave like the MERS outbreak that we saw in 2015. But it's behaving much more like an influenza virus, which means that we can use modeling from other pandemic influenza outbreaks to essentially model what we believe is going to happen with this virus. And that is primarily related to properties of the virus linked to the transmissibility, the seasonality, the duration, and how long we think it's going to take to produce a vaccine. But the most important thing to consider is that with viruses of this type, what we typically see are circulation in the northern hemisphere during the winter months when temperatures are colder, and then the virus will go and circulate in the southern hemisphere before returning, typically 8 to 9 months later. Contextually, since 1700, we have been tracking about 8 pandemics, and of the 8 pandemics that we have tracked since 1700, 7 of those have had follow-on waves of some form. And when we talk about actual pandemic waves, what we are referring to is the number of people who are affected, which is essentially the height of the wave, and then the duration or the length that the disease propagates in the community, and that's essentially the width of the wave. And so when we look at this slide, what we essentially see are 3 possible scenarios for how the pandemic could evolve in the United States. So the first scenario is what we call peaks and valleys, which is essentially that we will have a series of continuous waves that look much like what we had in the United States in the spring. And that we can essentially use a series of opening and closing actions to try to sort of decrease the height of the wave and the expected duration. That is probably a moderate probability scenario at this point. The second scenario is the one that I think people are really worried about, and at this point, which seems like it may be quite likely, primarily because of the spread of the virus in the southern hemisphere right now. So this second model, called the fall peak, is essentially a reproduction of what happened with the 1918 flu. And what happens in this instance is that you have a moderate-sized initial wave that's followed by a much larger and much more severe wave about 6 months later. And I think this is really what everyone is quite worried about. And it's a big part of why we need to be doing this work now, because if this much larger wave does come to pass, it will require significant alterations from our school operations. And then the third possibility is what we call the slow burn, meaning that we have this initial peak and that subsequent peaks are much smaller and tighter in duration. Now, our ability to affect those waves is not so much a function of the virus, which is going to continue to circulate in the northern and southern hemisphere regardless of what we do, but it's actually a function of our ability to sort of quickly identify cases and then quickly isolate people who were infected and then isolate their contacts. So a lot of how these sort of waves propagate in the United States is affected by our ability to set up a public health infrastructure that can sort of manage any future outbreaks. Next slide, or back to the prior slide, I should say. We move the slides back one notch. Yeah. So the problem with those models that I just talked about, though, is that that really gives a national model for how we think this is going to propagate. And so in order for local communities to determine sort of where they are on any given point in any given wave, you have to figure out sort of how much spread is in your local community. And so to do that, we relied on the US CDC's guidelines about how they define community spread. And the CDC specifically defines 3 categories. So the first is what they call no to minimal spread. The second is minimal to moderate spread, and the third is substantial spread. Where the CDC falls short, unfortunately, though, is that they don't give clear guidelines about what constitutes minimal to moderate or where those boundaries are set exactly. And so as a starting point, Opportunity Labs has created some boundaries that are mapped against 2 factors. So the first is what's called the basic reproductive number, and the second is the opening phase of the Delaware Roadmap that should help us decide whether or not schools should open or close or consider a situation-dependent opening. Now, just to highlight what that means, the basic reproductive number is essentially how many persons each infected person is passing the virus to. Now, when each person is passing the virus to less than 1 person, the disease should sort of taper off in the community, and that is an R0 less than 1. We expect that Delaware will be in phase 2 to 3 in that scenario, and the schools should be able to open, and you should have a low amount of virus spread in the community. The second scenario is when your R0 is approximating 1, meaning that essentially 1 person is passing the virus to 1 other person. Delaware is most likely in phase 1 to 2, and we expect that community spread will sort of stay at a steady state for a period of time. And then the third situation is what's called substantial spread, when the R0 is greater than 1 and each person is passing the virus to more than 1 person. For context, when this first started in the United States, the R0 was close to 5.7. Nationally, we're closing in on about 1 to 1.2, but there will be a lot of sort of community spread or community variation from place to place. But we expect that if the R0 is much greater than 1, that Delaware has likely moved back to phase 1 to 0, and schools will need to close. Now, these are not absolute markers because you can end up in a situation, for instance, where your R0 is less than 1 and your phase is closed. This is what you experience when you have had a lot of community spread and then you close everything down. This is essentially what happened in New York and New Jersey and Rhode Island a few months ago when everything closed. After your cases start to pass the virus on to 1 or fewer people, then your R0 goes down. But eventually, the R0 correlates with the amount of community spread after a series of cycles. So with that, I'll hand it back to Mike to talk about scenario 1.
Thank you, Mario. Alyssa, can you switch the slide, please? The other way. Oh, yeah, perfect. Thank you. So this leads us to scenario 1. In this scenario, there is minimal spread in the community and schools can open and operate normally. The big question and the challenge before us is, do we go with what's in the protocols, or do we want to implement increased safety checks above what's already in the document? We'll be looking at each protocol through 4 key questions. The first question is, what questions do you still have? What needs to be added? What, if anything, needs to be removed? And what needs to be adjusted to fit Delaware's context? So basically what we're doing at this point is we're Delawareizing this plan. Please note, as we start to transition into the discussion phase, that we will not be reading each section, but we will have a slide for it so that the general public can see what it is that we're discussing. Next slide.
Thanks, Mike. So we're going to start by, as Mike said, going through some of these things. And our ask of the committee is, again, to think about those questions that Mike asked. I'm not going to read every bullet point, but this first section is about mental, physical, and social emotional health. And so we have all of these different things. And so what we're asking for feedback on, and we'll try not to spend too much time on each slide, is, are there things within this list on this current slide that folks have thoughts about. And again, we don't need to have, this, just for an example, this says designate mental health liaison who will work with the district. We don't need to designate that person right now, but that's part of the plan. So are there thoughts on these general pieces which really kind of focus on the mental health and wellness? And there are more on the next slide as well, but on these particular ones, things you like, don't like, things that you think we need to have. And you can either raise your hand or chat if you want to make a comment. Okay, so we're going to go, I'm not seeing any hands, so we're going to next slide and keep kind of moving through these.
Just one second, we have a couple of hand raises. Kristen, do you want to go ahead?
Alyssa, can you move that slide back also so that we can look back at what we're talking about?
Sure. This one?
And then Kristen, you can.
Kristen, did you want to go ahead and talk?
Still getting my sea legs. Okay.
About that?
You're looking for feedback on this slide right now at this moment, because I have some additions to it based on conversations we've had with our school psychologists as well as our school counselors. Are you looking for that?
So I think it depends. If you've read through, because there's still a few more slides on mental, physical, emotional health. If you've read through this slide particularly and something particular on this slide pops out, yes, say it now. If you think that it might be, or if you've read through and think that there's some other pieces it touches on, we can wait until we're through the next couple slides.
I think for this side in particular, the first bullet point and the last bullet point, the one thing that we heard loud and clear from these specialist groups is that they want a seat at the table. Oftentimes the school psychs, school counselors, school social workers, the list goes on, but those specialists in particular are left out of planning groups, and they are actually the professionals that are dealing with it on a day-to-day basis. And they have the background, the resources, the expertise to really lend to the conversation. So while there may be, one person as indicated in the last bullet point, or just a general team established, we want to make sure that those professionals are there and heard.
Thanks, Kristen. We all are definitely in touch with the Delaware School Psych Association, and we'll certainly garner their feedback as well. But I appreciate that. We've heard that from a few people, and certainly we'll make sure that we are talking to them as it pertains to some of their specialty areas.
We also have
for
Larissa
our
who needs to talk. Larissa, can you go ahead? Yeah, there we go.
The idea of a crisis response. A crisis response team. I think one group of important stakeholders that are missing on this outreach slide is our parents, because they will ultimately need some support in terms of the social emotional health, and they'll also be impacting how their students are viewing coming back to the building, or whether their students come back to the building, even if we are in phase one. So there is a piece there with how to support our families beyond the student and the staff.
Great, thank you.
We do have a couple questions in the chat, just so you're aware. One of those is from Representative Mike Smith asking, how about the infrastructure for some of these do-nows like telemedicine, dependent upon our delivery, and other technologies and programs for implementation?
I think we'll certainly touch on some of those things. I think because this scenario is based so much on assuming we can return to school normally, we'll certainly touch base on some of those infrastructures that will be in place probably additionally, but I think we're for this scenario, because folks will be back in school, certainly I think that's, you know, on our radar, but I think for just this particular slide, this is just about getting us set up for these mental health supports. But I certainly, you know, I think we can revisit and talk more about the sort of technology piece and how this might fit in here.
There's also a question from Susan Habistro. Are examples of members of the crisis response team and also samples of questionnaires and surveys going to be provided?
That's a great question, Susan. I think that, you know, I mentioned this from the start. I think our goal today is to try to get through if we think these things make sense. And there's a reason we have to have this done by end of June, because I think there are going to be details to work out. And just like Kristen mentioned, more folks who need to be involved in those discussions. But I think our goal is just to figure out, do these things make sense at least for today?
There's also both another statement as well as a comment and a question from the group on the outside. And one of those is the reminder that there's also a separate subcommittee focused on the technology and operations side of this and making sure platforms are in place. But Ms. Daphne Cartwright, I think, has a comment she wanted to make.
Thank you. Yes, I just first of all wanted to second the input regarding parents on the crisis team. That will be very important. Also, having medical staff on that crisis team to respond would be important. And then just in regards to some of the assessing natural resources and providing resources to that we, you know, do not forget to consider the very unique needs of students with disabilities and their families. And the whole range of disabilities and what they may need to come back to school in the traditional sense.
Thanks, Daphne. You're certainly correct. That's very important, especially, you know, thinking about these kids with disabilities and making sure their families feel heard. I don't see anything. Am I missing anyone else over there?
Yes, we had one, Reverend Powell, I believe, wanted to ask a question, and then Representative Smith actually had another statement. But Reverend Powell.
Yes, thank you so much. With regards to mental health services and support, I guess I'm concerned about the capacity to deliver as much support that we're going to need. Not only are we dealing with the pandemic, we are dealing with this civil unrest that has now accosted the country, which has put another layer of trauma on our young people, which are going to have to be unpacked and facilitated. The other point I'll make very briefly is the last bullet on your screen in terms of leveraging the other community partners. I think that'd be important, how we expand that definition of community partners, because that resource is going to be very critical to stabilize our young people.
Excellent. We're going to keep moving just in time. I see there are a few more comments. I would like, if it's okay with the group, there are two or three more slides on the mental, physical, social, emotional health. Let's try to just move through those and take a quick look at them. Mike and I will go through those, and then let's see if some of these comments and questions are answered. And if not, I promise we'll make time to get to all of them. But I suspect some of the things that folks are speaking about are going to be in the next few slides. So Mike, I think you're on this next one. We can go to the next slide. We lose Mike.
Mike is.
Mike, I think you're muted.
Muted.
There you
go. I'm sorry. The next section in the mental, physical, and social emotional health is before school opens, and we're going to look at it through the same 4 questions. Are there any questions, anything that needs to be changed, anything that needs to be added?
I think you'll all see here too, there's a little bit more about parents as well. And again, if folks are okay with it, we can look at this one, move to the next one, and then take questions and comments overall.
If there are no questions, maybe we can move on.
Yeah, let's go to that next slide, Alyssa. Okay, so when schools are opening, again, I think there's quite a few things that folks have touched on. Things that I just want to point out on here are, I know there's been a lot of talk in Delaware about mental health screenings in schools, so this is on that plan. But I also just want to point out here this piece about not being expected to perform COVID screenings as the school at this time, and certainly maintaining the mental health support. We can go to the next slide because this is kind of a two-slide piece. So again, a lot of this is based on mental health, but also preventing spread of infection. As you'll see here, this is where we start to talk about some of the physical health. So the cleaning, the personal hygiene, washing hands, vaccinations, those types of things. So I don't know if folks have, now that we've gotten through, that's the end of the mental, physical, social, emotional health piece. I want to get back to folks' comments. I'm just looking up here. I think Kristen Dwyer, I think you were the first one to say that you had a comment on that last one. So if you want to go ahead and make your comment now that we've gotten through some of these.
Well, if you don't mind, I have a couple of questions just to orient myself. It appears that the last 4 slides are a combination of addressing the mental, physical, and social emotional health of not only staff, but to an extent parents and students. Is that correct?
Right.
Okay. Because, and I don't know how you want to establish kind of what we're going to talk about first and then what we're going to talk about next, because you've got mental health and physical health kind of lumped together here. So if it's okay with you, I just want to take a moment to talk about the mental health. The one piece of feedback that we've been getting in terms of communication with parents is that they are bombarded right now with information coming from all directions regarding districts and how the state is handling the COVID-19 response, especially to a greater degree, those parents of children with special needs. They have, members of the IEP team calling them, asking them questions, providing them with information, asking them if they filled out this survey, that survey, that type of bombardment. So right now, I think parents are starting to feel overwhelmed with the responsibilities they have to care for their child, depending on what ability they may or may not have, whether they're special needs or not. I feel that parents are starting to be bombarded with a lot of information, including information on self-care and how to talk to their kids and everything else that they need. And they have to do that while maintaining potentially a full-time job or looking for other employment. So I think that has to be something to consider, is how to condense, consolidate information, and what the best way to do that is for parents, so that they don't feel completely overwhelmed as they head back into school. Now, our specialists have said that our specialists have categorized this COVID-19 pandemic as a crisis. That's what they keep calling it. And they are very concerned about what the immediate needs of their students will be come September if they return to bricks and mortar learning. And what they have said time and again is that they need time to address the mental health of their students, to address the PSTD that they may have, from anxiety to thoughts of suicide that they may have been experienced over this time, to going back from learning digitally to a schedule. And there's a concern amongst specialists that districts will not give them the time to really focus on the mental health of the children. Rather, there will be such pressure on curriculum, getting students learning again. But our specialists feel they may not be in a place to learn mentally. So I did
Thanks, Kristen. I appreciate. Yeah, no, I appreciate that, and I think that's absolutely right, and that's why mental health is part of this plan, and that's why there is talk of not just screen kids and let them go, but also how do we support them throughout. And I think certainly your specialist you're talking about will be really helpful when we talk about what exactly that looks like in each district, in each school. And I think that what we know very well through research is that when traumatic events happen, when crises happen, every kid reacts differently, which is why screening is so important. We know that not every kid who experiences the same trauma has a traumatic reaction, so we really need to figure out which kiddos need the most services, and we will, I think certainly continue to have that discussion. So I appreciate that feedback. I think the next, Stacy, I think you said you had a comment before we move forward with the slides. I don't know if we've answered any of those or if you still have some question or comment.
Hi, good evening. I just wanted to touch on the staff and making sure that they are prepared to welcome the children back. I agree with what everyone is saying. There is a definite mental health crisis going on for a lot of our students. And when the Reverend touched on the other things that are going on in the world, the children have a lot of need. And I want to make sure that the staff is prepared mentally and physically to welcome them back. It's been very hard on them to make the adjustments to do this online teaching very quickly. I know they're concerned about the loss of instruction and making sure kids are where they need to be educationally. So we don't want to lose track of the mental health piece. And I think we need to definitely keep in mind where the mental health needs are of the staff, because they're the ones who are up and modeling for the students every day. So we don't want to lose track of that.
Absolutely, thank you. Trying to see. I'm just going to, Sue Smith said communications to families need to be in multiple languages. The sooner we get that information out regarding symptom checking and keep your child home, I agree. So, Sue, I see your comment on there, and there's this whole section on that as we move forward in terms of the protocols. So if you don't think that's well enough, or if you think we need to get more info, I wrote down the comment about different languages, but if there, as we move forward, are more, certainly let us know. And then the other comment was, since communications is a key component, should there be a separate focus area on communication versus several bullets? That's something I'm interested in other folks' thoughts on. But I think you're right. We're hearing a lot that the communication to families and teachers is going to be essential in making sure that we do this correctly.
This is Representative Smith. Just one other thing to add in terms of the communication side. I think it would have been good for the public at some point, but I think some more PSAs maybe from the teachers and the principals and the leaders to how the parents are teaching how to wash hands for when they're going to be in school and when they're home, any sort of like social distancing type stuff like that.
Thanks, Representative Smith. There, again, in the protocol section, you'll see a little bit about talking about that. So I just jotted that down too, that it would be helpful to have sort of parental education from leadership on that, because there's a section on that as well about things like hand washing. Other thoughts, questions, comments, you can put them in the comment box, raise your hand. I hear all of these comments. I've written them all down. I'm going to try to synthesize them, but overall it sounds like lots of concerns and thoughts about making sure we're communicating effectively, including parents, staff, and also mental health specialists.
Megan, we have another comment. I think Dr. Fitzgerald would like to make a comment.
Yes, I'm looking at all of this, and while I appreciate all of it, the previous slide scared the death out of me with regard to opening. And I'm looking at it from a practical point of view of what it is school districts and schools have to do in order to open school within another month or two, because our target date right now is August 26th. So while I see a lot of the things here and I hear the comments that are being made, my perspective on this committee is what do I need to do in order to get my school open and get the kids in there ready to learn? And then, then do I start doing a lot of these other things, or is all of this supposed to be done before I even open the doors?
Yeah, I hear you. I think those are a lot of good questions. And I think just want to have this as a reminder that, as Mario said, this is really just if we're not seeing a lot of spread. So I agree, those slides are scary and it feels overwhelming, but this, you know, the goal here is if we don't have a lot of spread, what can this look like effectively?
No, I understand that. That's why I'm wondering, as we're getting into the details here, how much each individual school district, how much each individual charter school is going to actually be able to do if, in fact, we have a minimal spread and we're ready to open, in my case, on August 26th.
Megan, we have a couple of other hands raised as well. I think is it Dr. Santiago?
Yeah, yes. Hi, how are you guys doing? I have a question. The area that I work is Georgetown. Our office of Lorette is Georgetown, Seaford, and Milford. Our areas, our school are extremely overcrowded. My concern is how are we gonna work with the social distancing and in our areas. Our school is extremely overcrowded.
So as the facilitator, moderator of this conversation, I am in no way, shape, or form the expert in any of these areas. I'd like to return the conversation back, unless Mario, you can answer some of those questions. I'd like to take the conversation back to the task at hand. These are all wonderful questions. What we wanted to do and what we wanted to work on is the plan that's been laid out before us. And I want to take us back to the 4 focus questions that were presented in the assignment that was given to the committee and the assignment that was reviewed. You know, what questions do we still have, which is great, we can capture those questions. What needs to be added, if you have any ideas to that? And what, if anything, needs to be removed? Because remember that the charge is us having a plan to present to the Secretary of Education and to help educational leaders to make decisions. I cannot answer all those questions as I am not an expert. I am like you. I am just a co-chair here to facilitate the conversation. So what we will do is we'll document all these conversations. But if there's feedback on what needs to be added, what needs to be removed, and what needs to be tweaked, that is something where we could address immediately. As far as the questions, we'll have to regroup and find answers collectively.
Yeah, I think the other thing is let's get through some of these protocols, because I think Dr. Santiago, some of it is addressed in some of those questions you're asking is actually addressed in those protocols. Senator DiColo has a question. Go ahead, you can ask that, and then after that question, we'll try to move on.
Thank you. So I actually have a question about the current slide, and it's referencing the CDC and the CDC's recommendations, which was briefly, and maybe it's obvious, but I want to make sure that we all understand, and for the public, because the public certainly reviews the CDC's releases and is interested in making sure that, you know, government's doing what it should and for accountability purposes. Is the CDC and their recommendations the standard for how we're looking at doing things as we lay out this plan and continue to develop that? I just want to make sure I understand that, because I know folks will ask me the question later. And then the other couple of questions I had were about the most recent slide about updating student and staff health records and finalizing them, and just unpacking what some of those words meant. I think I have an understanding, but for the folks watching at home, I want to make sure that there's some meat on the bones of this discussion.
Mario, do you want to address the CDC question first? I know you typed in the chat, but for the public so that they can hear the answer to that.
We are not able to hear.
Let's see. Are you able to hear
I
me?
can't hear you.
Let's see. Are you able to hear me?
Okay.
So I believe that the CDC here in the United States is the standard bearer for public health, and they're the sort of foundation upon which this document is based. The CDC is essentially our leading public health authority in this country. And the sort of politics aside, I think they provide the public health data that we use to drive those decisions.
I think that's pretty consistent with what I've seen as well. I mean, for example, at one point in time, we didn't think face masks were generally necessary. That guidance is adjusted as our understanding of the pandemic is itself adjusted. So I just wanted that to be clear because I think as a foundational principle, and when people do have questions, they look to the announcements and the recommendations, and I think it's useful for that discussion. So I appreciate that very much. And then the other question I had was about what is meant by updating and finalizing health records, and what is meant by the timing of vaccinations and things of that nature, because I think folks would be curious about that in terms of making sure that they're meeting the gold standard for their family's health and how we're coordinating that.
It's a good question, and it may need some more kind of expansion here. The intention was that students should be required to submit their standard vaccinations records to schools that they normally submit, and then if they choose to identify as having a prior existing health condition, they can do so. Although we'll probably discuss more about whether there's a responsibility to do that with COVID. At this point, there's not a mandatory requirement for anybody to report an underlying health condition.
Thank you.
So, and I'm sorry, I realized that probably didn't hear my comment for the prior discussion. I was just going to say the question about when schools should open or what needs to be in place beforehand. The prior slides actually have a banner at the top that talks about what needs to happen sort of now and then before schools open, and then once they're open and operating. So that can also be used to sort of guide some of that decision making as well with the protocols that we're going to talk about.
Is this a good transition time to move on to the next slide?
Yeah, go ahead.
One more. Okay, great. So can we go back one, Alyssa? So this slide just an overview and protocols that we have to still review, utilizing the same 4 questions to frame each of the protocols. So without further ado, why don't we start with spacing and movement on the next slide.
So I think this gets to what some folks were talking about before, but again, under this scenario, and again, that's with very minimal spread, there are not going to be changes to class size or spacing or changes of movement between classes. Any questions around that specifically? And again, this is just for this scenario. You can go to the next slide.
So this next slide covers the screening of students.
I think we have a comment. I think Reverend Powell wanted to say something.
In terms of spacing and with regards to spacing and movement, and best case scenario, we don't have community spread, but if we had to transition from that scenario to a medium potential, I think we still need to maybe have a hybrid between, so the change wouldn't be as radical, or I think gentleman spoke earlier about it's hard to define or delineate between different scenarios. But if we want to be practical and prepare for a possibility, if we take the one stance as if it's not going to happen and we don't prepare for what if, I think that wouldn't be a prudent way to proceed. Just a thought around that size in classrooms, spacing in classrooms. Just a thought.
Thanks, Reverend. And during our next meeting, we're actually going to talk about exactly that, which is what happens when it becomes minimal to moderate, and we need to start thinking about those things specifically. I'm just looking over at our comments. So Sue Smith said, a concern that nurses' offices are small and may not have space to isolate. That is certainly something that we need to note and think of perhaps what are the alternatives to that.
Megan, I think Laretha wanted to make another comment.
Sure.
She may still be muted.
I unmuted her. Laretha, can you go ahead and talk, or is it not working? Well, let's move forward.
Laretha, for some reason you can't. Oh, God. I was just going to say, Laretha, if for some reason you can't unmute, we can't hear you. If you want to put your comment in the comment chat area, if you're on a computer, we can read it. Okay. I'm reading also some comments about thermometer concerns. That's also a really good point to bring up. Not all of our parents have thermometers, and certainly as we're thinking about equity, that's a really good point to note here. Folks are saying we assume that parents can check temps, but they may not be able to do this. And Dr. Santiago said also many of her parents have a hard time taking that temp. So that is noted, and we will certainly need to think of some ways to address that. If anyone has any suggestions, certainly you can comment and let us know, but thank you for bringing that up. That's a really important point. Let's go to this next slide, which sort of talks about students who are positive, but also I see just one more comment on here. For students sent home, will they need a doctor's note to return to school? As this stands and says, you know, on here, it's about not having symptoms. But Mario, I don't know if you've had that discussion with other states or via planning about whether or not, you know, the overall goal is to have a doctor's note.
As of right now, the CDC does not recommend requiring a doctor's note, but it's unclear if they're going to change that guidance in the fall. That we should probably flag that as an area that may evolve with CDC guidance in the fall.
Okay, so this next slide goes a little bit more into not just screening, but also about students and responding to positive cases. Thoughts on these sort of, I know these are big bullets, but I know we already mentioned the school nurse's office. Thank you, Sue, for bringing that up. Any other thoughts or concerned about this particularly with the testing for students and responding to positive cases? That's from my page. Senator Del Colo, I see your comment about how can we accommodate change to class size. We are going to talk about that during our next meeting. So right now, because this protocol stands as we would not be changing class size, we're going to hold on that one. And Mario, maybe you can answer this one. Sue Smith asked, will a screening tool be designed for parents in school, such as they had for H1N1 and Ebola?
Sorry, I'm just trying to find the question. So we would recommend using the same, I think, visual tools that the CDC uses. So if we go to the CDC website, they have specific posters and signage that are related to hand washing, symptom checking. I think we should plan to deploy those, through a variety of school resources deployed through the Department of Education.
I also see a comment in here about students with disabilities may have a difficult time putting on a mask. Daphne, that's a really great point. This is a Nemours note, but Nemours has worked really hard on some protocols around our kiddos with different needs and masking, and I am happy to share those and to make sure we have that discussion further, because you're right, when we talk about putting a surgical mask, we need to address that. And then the next question, we can go to the next slide, because Laritha's question sort of goes in combination with that first line there, that parents should be notified of positive cases in the classroom to encourage closer observation. Again, I see that temperature check, so we will make sure that we address that issue. Any other thoughts on this slide particularly? Senator Cola asked, will the recommendations and directives here essentially track what has been put in place for broader instructions from DPH when an individual tests positive? So yes, there is overlap, including recommendations of how long you isolate, et cetera. So that should be in coordination and consistent with DPH.
Thanks, Megan.
So here's a question from Daphne. If there are positive cases within the child's classroom, will flexibility be offered to families in regards to attendance? That's not specifically in this plan, but I think, certainly we're open to folks' thoughts and any input you might have or thoughts around that. Okay, let's go to this next slide. I'm just trying to watch our time here. We're doing a pretty good job, but just wanted to, I know we started late, so we will give that extra time also.
So this next slide is responding to positive tests among staff and students. Any changes, anything to add, any questions?
Daphne, I see your question about individual and unique needs. Our very last point today is going to be talking about some of those vulnerable kiddos and staff. So let's hold on that, but I see that.
Megan, I think Daphne wanted to make a comment. Daphne, I unmuted you.
Thanks. I just have a question. I'm a little confused. This talks about if the person was in the school building without a face mask. But earlier slides where we're talking about separation and barriers and group size and those kinds of things, we said there's not a need for that during this phase because there's minimal to moderate spread. So I'm just confused about how this slide talks about people if they weren't wearing a face mask. So I thought like that physical distance and face mask protections kind of go together at the same time. So I just wanted to make sure I'm understanding right what is meant here.
Mario, do you want to answer that question if you can?
Yeah, so this is it. That's specifically meant to refer to the person who comes into the building and then eventually tests positive, and the Department of Health is doing contact tracing and finds out that they were in the school 2 days before, essentially. So you're right. No one is supposed to be using a face mask here, but if there was somebody who comes into the school and obviously wasn't wearing a mask and then eventually turned positive, there would be downstream effects that we would need to account for.
Mario, while you're on here, the other question I think you could be helpful in answering is Sue Smith asked, the first half of the question is, are letters going to be sent home to families regarding a positive student? But then the second piece of that is, if a student's in a different building or a different class, how will we handle the other family members? And I think the answer is that we're asking them to just increase monitoring, not keep that kiddo home, but I want to defer to you to make sure I'm getting that right.
So the CDC would recommend in that instance that if you are a close and continuing contact and you've had that contact with somebody who is positive, that you should stay in quarantine for 14 days. So in that instance where it's a sibling, they should also stay home.
Okay, we're having some questions about mixed modeling. I think, again, this model is for minimal spread. And as you heard Mario talk about, we may not be in this situation, and this would be a super positive. And I don't want to ignore all these questions, but I want to save them instead for next week. A lot of folks are asking about some virtual, some physical, in terms of getting things under control, and will there be transition phases? So a blended model is certainly something we'll talk about. And we want to make sure that we are being conscious of all these options. But I think, again, just for this week, we're talking about this very minimal spread. But I appreciate the feedback, and I think you're all correct that we need to think about, when we get to that more mild to moderate spread, what we're going to do next. Okay. Any other specific comments? Oh, Representative Smith said, also consider children going home to parents who are high risk or being raised by grandparents of a high risk age group. Again, we're going to talk a little bit about vulnerable populations at the end. This specific scenario is not calling for N95. Senator DiColo asked about supply chain. We can talk more about PPE as we move forward, but this particular scenario is not calling for N95. The only mention for this one is surgical masks.
Cleaning staff.
Okay, we can do next slide.
Staff. Okay, good.
Megan, I think maybe Dr. Fitzgerald had a comment.
Sure, go ahead.
Well, basically, what we see here is pretty much what the CDC has already put out for opening, the opening of schools. Is that correct?
A lot of it.
There isn't much variation from what I recall being on that webinar to what I've seen so far today. So that's just, it's pretty much a standard application right now.
Megan, I'm happy to answer that and say, yes, that's true.
Senator DiColo also, it sounds like, yes, in line with CDC, and then Senator DiColo was talking about the cleaning staff with N95s. Certainly that's something we can circle back to DPH with. I know that there has been talk about better supply for our hospitals right now, and so we'll check in with them and make sure that that's something that we can address.
Right. My comment, and I agree with Senator DiColo that we have to take care of our custodians as they clean up and that. But basically, really what we're reviewing tonight is basically the CDC guidelines that have been put out in a best case scenario for us to return to school. So that's their recommendations. And then as we move forward, what we'll be doing is discussing the nitty gritty of what happens if we use different types of the hybrid or the remote learning in order to talk to students or to provide the education.
Yeah, that's exactly correct. And Mario just said that's correct as well, Dr. Fitzgerald. But yes, that's exactly correct. This is just minimal spread. What can we do in best case scenario? Let's move on to that next slide. So this is just about dining. Again, I think this reflects what Dr. Fitzgerald just said. This is really an optimal best case scenario. A lot of this is just normal functioning.
Yeah, I think I have something wrong. Oh.
Kristen, I see your comment here. Kristen says, where are teachers washing their hands? Again, I think the goal today is, do we think these things make sense? And if so, then we need to problem solve some of those things. I'm going to jot that down. But again, I think our goal here is just to figure out, do we think this is something that is useful? And that might be hand sanitizer. I'm sure Mario's done some problem solving in other places, but I think our goal here is just making sure that that's on the list.
Yeah, that's right. There are, Megan, just to address that, there are some different strategies you could use. You can either use portable sinks or you can use hand sanitizer. But I think that the question, right, with these protocols is determine if we can successfully do these things. Because if we can't, then the recommendation, that the secretary may make that we cannot reopen school in the fall. I think these are the protocols that we would need to do it safely, and then the feasibility of it is a separate question that determines whether schools can open.
Yeah, there's a couple questions about that. I think that's something then we need to dig into a little bit more and maybe have further discussion about this hand washing piece, because there's a few comments here about making sure we're training folks and then making sure that that we could have this. Sue Smith just said working on freestanding hand washing stations, possibly exchange for water fountains since they have a water source and a drain. I think definitely we can certainly have more conversation about. And Mario, I think maybe if you can give us some examples of what other folks have done as we move forward, that would be really helpful to your point to figure out if we can do this.
Yeah, I think most folks are talking about using hand sanitizer as people come into the cafeteria eating area. So you can use it before you leave the classroom, once you arrive at the cafeteria. It's probably individual logistics of the school itself and knowing where you have, bathrooms and sinks available.
And Daphne asked, can we purchase that much hand sanitizer? Or families report it's hard to locate. That's certainly another thing, just the supply chain, making sure we can do that. Okay, let's go to this next slide. I know we only have 15 minutes left in our meeting. We did start late.
Next slide is athletics. Again, any questions, any changes, any tweaks? Anything to add?
I would just question whether equipment could stay at the school and be sanitized there, or some students take their equipment home and bring it back. That might be an issue.
Okay, let's do the next slide for now. So we talked a little bit about PPE already, but this is just another overview. I see some of these questions popping up, especially about our special needs kiddos. We will get to that. That's our last slide today, so we'll return to those questions. And then Kristen Dwyer commented, add scheduling during meal times. We might need to schedule longer lunch times to accommodate for hand washing, especially dependent on age. That's a great point, Kristen. Senator Del Colo, go ahead. You can ask your question.
So I'm just reviewing this slide and thinking about the other slides regarding youth and physical distancing and all the habits we want to get people to embrace to prevent the chance of a hotspot developing in one of our schools. That seems to be a little bit in tension with having all the other things from the prior slide being normal. So large gatherings is normal, everything else is normal. I mean, maybe there are some places that can accommodate with the appropriate social distancing and all the things that we're recommending, but I just wanted to point out that that's a little bit in tension in my mind.
Mario, anything specifically about that? I mean, I think
I'm sorry. I think it. Yeah, that's probably just a language choice. I think in this slide we were recommending that there should be no distancing. This should just be a normal operating status. So there shouldn't be any physical distancing here.
Megan, I think Laritha wanted to make a comment again. Go ahead. Laritha? Oh, maybe not. Okay.
I think her question was the same, so I think that's probably why. All right, we can do the next slide.
So this slide's a biggie, cleaning. And Alyssa, it continues on the next slide if you want to just flick back and forth so that everyone has a chance to view them.
Sure. I'll go back one more time. And we'll go forward again as well.
Thanks, Alyssa. While you're doing that, I'm just going to comment on some of these things. Good point. Kristen said school buses too. Mario, I don't know if you've talked about that with other folks about cleaning school buses.
I'm sorry. What was the question about school buses?
Yeah, about cleaning the school buses, I think.
Specifically brought up in the next protocol on busing and student transportation.
And then Daphne said, can we verify again the supply chain to implement this? So again, I that's a big one that I keep writing down over and over. And then Sue Smith said it should not be a student responsibility, and students should not be present when cleaning is in progress. Just in the interest of time, any other comments? I know busing is next, and then we have to still get to our medically vulnerable populations too. Okay, we can go to the next slide, Alyssa, I think. Oh, sorry, Kristen, I missed your last question. Do all schools have disposable cutlery, maybe switch to bag and go meals? I don't know the answer to that question, but Mike, I don't know if you know from a DOE perspective, but we can certainly find out.
I don't know for sure, but I can get you an answer to that. But I'm pretty sure that that's what we would be heading towards, and the bag and go meals would be something that would probably be a very strong possibility to avoid too much touching and exposure.
Okay, comments or thoughts around the busing piece? Again, as you can see, most is normal operating procedure. Okay, let's go to the next slide.
Alyssa, in this slide, it also continues. So if you could just give it a second and then also show the second slide.
Sure.
I just want to also read Sue Smith's comment that bus drivers are most vulnerable, even in this scenario. Potential for bus drivers to have a divider or wear a mask. Sue, Mario, I don't know if you've had any discussions about that outside of Delaware and other work you've done, but just I'll write that down as well.
Yeah, it's an interesting question that hasn't come up in this minimal scenario, but it's a question for the group about whether or not, we think that they should be able to do it. I don't see any reason why not. It's just a question of whether we want to offer it to them.
So I think, we want to spend our last 7-8 minutes that we have talking about these vulnerable populations. I sort of flagged this when we were having discussions outside of this for Mario and Mike, and I think a few of you have already commented on that. So certainly Dr. Santiago and others who have commented, I know this is sort of saying they can attend school as normal, can self-identify as having high risk for planning purposes, but I'm curious on people's other comments and particular situations. Okay, I'm just going to read these couple of comments, and then Senator Delcolo has a comment as well. Sue says, we will have parents that will want to keep their children home and continue virtual learning. That's a good point. And then Daphne, I see your comment here. I think we need to, sorry guys, the chat moves. So I think that this needs to change and include some flexibility that is individually determined, which I think expected some of these conversations. Senator Cole, go ahead, you can make your comment.
Thanks, Megan. I was just going to point out, and I think some others alluded to it, but when you look at the fact that the way Delaware's Constitution is written and some of these legal requirements, I continue to think that having some sort of robust virtual learning process in place is going to be very important, because we got to make sure everyone has access. The ADAA and the IDEA are pretty clear on these points, as well as our own state requirements. So obviously we'll get into that in more detail, I think, when we talk about the hybrid learning model, but I think developing that and providing that infrastructure and know-how is going to be important to make sure that folks are accommodated, because there are definitely going to be people who want to err on the side of caution, depending upon what their individual health concerns may be.
Yeah, thanks. I think that we expected some of these conversations around this. Working in a medical system, I certainly said I think this will be a little bit difficult for folks to swallow. Sue Smith, I think, makes a great point, which is we want to encourage conversations with medically fragile students with the school, parent, and medical provider together. And Daphne commented that students with IEP should be able to use that IEP process. Reverend, I think that's you, who said they also had a comment.
Yeah, very briefly. When we talk about vulnerability, it says medically, but I'm just saying systemically, when students are from low socioeconomic status, that's a vulnerability inherently. And I was looking in the abstract where it talked about students from low socioeconomic backgrounds. Almost 30% of them are designated as having learning loss. So that I think we need to really, I know in all the scenarios, we need to keep that in the forefront of our mind. That's why I just wanted to point that out.
Certainly, I appreciate that. And I think what I really am hearing a lot of folks saying, and I think we need to continue this conversation, and certainly I will try to kind of sum this up, but I think what I'm hearing all of you saying is we need to consider what alternative options there might be, whether that's through our IEP processes, IDEA, to make sure that students' needs are being met even in this low-risk scenario, for a number of reasons that might make students vulnerable. I'm just trying to read. Kristen also commented about school refusal. I think school refusal will be an issue this year. I think that is a possibility. And again, I think that goes back to parents not wanting to send their kids. Part of that's the communication. Part of that is addressing this. Senator DiColo said one idea for special needs students is about to time out of their programs is to give them an extra year paused by COVID. So I think those specific programs certainly can think about that, and Daphne probably can weigh in on that. And then Daphne just commented, the slide mentions people may self-identify, but doesn't say what the outcome may be. Agreed. So I think those are I'm aware of our time, but I also recognize that perhaps the rest of the things, I think everyone made really, really great comments and had great input on it. And I've written these notes and I will sum them up and get them out to our committee. Mike and I will work on that and making sure that the public can sort of see what comes of this. Mike, I'm going to kick back to you just for a second to your opinion, and Mario, but it sounds like perhaps around this we need to let people think about what might be something that's really some things that we can do and what we need to add specifically to this, and whether that ends up being making sure that students are using IEPs as needed for this, and or that those students are having individual conversations. I think it sounds like we need to definitely add some things in here. Senator DiColo says he has one general comment, so go ahead, and then I'm going to hand it back to Mike for any other comments.
Thank you so much. So one of the things that was raised by many members of the community when I put out the information for them to stream and be aware of what we're doing, since this is such a pivotal topic, was the concern about public comment and the normal structure for that. Sure, there were probably comments in the written comments before asking for the ability to make public comment after. I think, even though we have this special set of state of emergency orders out there that lighten or make more flexible the requirements of FOIA, I believe it is beholden on us to try to accommodate that, because this is very pivotal stuff. I'm willing to spend a little bit of extra time. And if that means we have to change the format or the technology we use to do this, I just want to make a real vehement request that we accommodate those interests and provide for an opportunity for public comment, because a lot of this interaction, a lot of the questions and the iterative process we're doing is relevant to them, and they need the ability to have their voices heard after we've done that in that sort of way, when you're engaging that sort of didactic interaction that I think is really important. So thanks.
We'll definitely share your opinion with leadership.
Okay, I think we can move on to just our closing up then. The next slide, Alyssa. So overall, as we conclude our meeting today, I think I tried to do a general recap, but I think it sounds like we have some things to input that you have all given us, which we greatly appreciate and are really thankful for. I hear you, Senator DiColo, and I encourage folks, at least for this meeting, to please email or call if there are comments on this particular meeting, since this is all we have for right this minute. So please do that and get us questions and comments. I would ask of our group that you think a little bit more about these vulnerable populations so that we can add formal things into this plan, because I think that's one of the biggest places where we need to change a little bit. We will make sure that we recap and get in writing all of the suggestions that are made, and Mike and I will work to get that worked into here, with our goal being that either very beginning of next meeting we can revisit a few of these things, but our goal really is to wrap this scenario up as quickly as we can so that we can move forward. Mike, anything else that you think is important before we close for the day?
I'd like to thank the committee for all the feedback that's been given this evening. And I apologize for the kickoff for the late start, but thank you, and I look forward to working with you next week. Okay, so our meeting next week will be on June 9th from 5 to 6:30. It will be scenario 2, and the topic of discussion will be minimum to moderate spread. And the information will be sent to the committee tomorrow morning. Again, I want to remind everyone about public comment will be accepted via email at reopeningideas@doe.k12.de.us or by voicemail at 302-735-4244. Thank you and have a good evening.
Thanks. Bye.
Take care. Melissa, if you will stop the live stream.
I sure will.